Hi everybody, Dr. Fulton here at SKINovative of Gilbert. We're excited today to do our live stream. I will say we're all a little bit nervous because we haven't ever done this before, but we're really excited about our SKINovative Elite membership program. We're going to be talking to you about that today, which is exciting. We're also going to be giving away a lot of products and prizes. Everybody who's on here today is going to get a prize that retails for $50. And then we're going to be giving away prizes of over $6,000. So let me just tell you a little bit about that. As we're going through this, we're going to be giving you answers to questions that we're going to be asking. And when I ask a question, we're going to ask you to enter it into the comment box. And we'd love for you to say your name and what your answer is. And then we've got some really smart technical folks here that are going to help us see who that is, and we'll do our best to announce the winner. We'd also like to say that we want everybody to have a chance to win. So only one prize is going to be given away, plus you're going to get that gift bag that we talked about. SKINovative, we've come a long way. Karina and I started with our esthetician 12 years ago. That esthetician has gone on to have 3 or 4 children, and she's working as an emergency medicine nurse, and she helped us start. And we now have grown and just excited about the last 12 years. Karina, what are some of your favorite memories over the last 12 years?
Well, the first thing I love is being able to meet new patients, learn new modalities, new treatments for patients, and then to be able to treat them in a way that can better their results here in our office, also that helps them feel better and be happy.
Yeah, we love that. We really love helping our patients be happy, and we love helping our patients have more confidence. If you look at why people do aesthetic services, one of the top reasons is confidence. We want to have confidence when we're in front of the Zoom meetings that all of us are doing now. We want to have confidence when we're going to family functions. We want to just have confidence. And so that's one of the things we want to do. And so what Karina and I have tried to do is make best-in-class services and products for our clients. And as Karina and I have kind of brainstormed and brainstormed with our staff, you're going to get to meet all of our staff members today. We've really brainstormed on how we can best offer all these services to our clients, and we've had thousands of clients, and we've loved getting to meet each one of you. We love your story, and we want to continue to be part of your story. And so we brainstormed how can we best do that, and so the best way that we can do that is have what we call the SKINovative Elite membership program. We're going to talk a little bit more about that, but we're going to talk about services that we offer. Some of you know about all of them, but most of you only know about 1 or 2 of them. Before we go any farther, I'd like for Stephanie to come on screen here. So Stephanie, I love that wave. Very nice.
Yeah.
So I'm going to ask Stephanie, she's our patient care coordinator, and I'm going to ask her to tell us a little bit about her.
Yeah, definitely. So as Dr. Fulton mentioned, I'm Stephanie, and I've had the pleasure of working at SKINovative for over 6 months now, and I also am a licensed esthetician.
Which I love that. First off, we love her smile. If you notice, everybody smiles here at our office. We actually love what we do. And we love to make our clients happy. And so Stephanie starts that off right by when she answers the phone. I'm sure you can hear her smiling when she answers the phone. But really, even more importantly than that, is she really knows about aesthetics. She's an esthetician. How many med spas have an esthetician answering the phone as the patient care coordinator? So when you ask her questions about your skin or about services that we offer, she really knows. She's an expert. And really, that's what we offer here. We offer best-in-class services with best-in-class providers, and that's what we're really excited about. So what we're going to do now is we're going to transfer to a different room. We're going to have some slides up, some music. Hopefully you don't fall asleep, and we're going to take hopefully no more than about 60 minutes of your time today, and then we'll go from there. So we're going to transfer to a room and talk about some services. See you in a minute. Hi, everybody. Thanks for staying with us. I have Rory here. Rory, why don't you tell us a little bit about yourself?
I've been a nurse for 13 years and in the aesthetics field for the last 7 and SKINovative for the last year.
And we're really excited to have Rory here. For those of you who've got to meet Rory, she's outstanding. Just a really good person, and she really goes along with what we're trying to do here at SKINovative. She's really a best-in-class injector, and all the services that she offers, she's just awesome. So Rory and I are going to talk in this room. We're going to talk about some services that we have to offer. The first one is Botox. For those of you who haven't tried Botox, I'd highly recommend it. There's only one downside to Botox, and that is you're going to get addicted to the results. Botox is really easy. It's not really painful. It lasts for 3 to 4 months, and it works fantastic. And so patients really get addicted to the results, and it really makes you look younger. The new Rage is really helping to prevent those wrinkles. But if you already have the wrinkles, don't worry about it. Botox is great. So you may be asked the question of 3 to 4 months here in a little bit, so remember that. And then, Rory, why don't you tell us about dermal fillers?
In addition to Botox, we also have dermal fillers. We have all of the allergen products. So we have Juvederm. We have ones for mid-facial volume loss, like Voluma. We also fill in some of those smile lines, some of those lines above the lips. We do also lip enhancements, and one of the newest FDA-approved areas is the chin.
Awesome. And I forgot this. You're not gonna get quizzed on this, but Botox Cosmetic just turned 19 years old. For those of you who are waiting to see if this is a fad that might go out of vogue, it's not going to. It's 19 years old. So it's safe. We've treated thousands of patients here. It really works well as thousands of patients with dermal fillers. Kybella. If you haven't heard about Kybella, Kybella is a medicine that you inject under the chin. We call that the submental region, and that helps destroy the fat. So for patients that have that fat right under their chin and they don't like it, we recommend you to come in for a consult. Rory and I will do a consult and see if you're a good candidate for that. And I think that's one of the reasons patients really love to come here for us. Rory and I will tell you if you're a good candidate. If you're not a good candidate, we'll tell you. And if we can't offer the service, we'll make recommendations on somebody who can. So Kybella, it often takes 2 to 4 treatments to get you to the place where you want to be. And those treatments are usually 4 to 6 weeks apart. So 2 to 4 treatments, usually 4 to 6 weeks apart. Rory, why don't you tell us about Pdo Threads, the smooth threads?
We have what's called Pdo Sutures, and those are resorbable, and they are placed for fine lines, textural, maybe some of the crepey texture you see around face, neck, décolleté, and those are collagen building. So they're a little bit different than where we would use the Botox or the fillers for volume loss.
Yeah, awesome. So again, just being able to give our clients and patients the best results that they want, the best cosmetic look. And that's what we've been striving to do here. All right, get ready. We're going to try this. Our first time, we're going to go for some prizes. So remember, if you know the answer, put your name down, your answer, and click that button as quick as you can. So what I do right now is I put your name down. All right, put our name down, and Dr. Fulton's going to tell you what you're going to win. So if you don't want to win this, don't put your name down and go for the prize. I would want to win this. So this is for 30 units of Botox. So that's over $300. And here's the question. So this is for 30 units of Botox. The question is, how long does Botox last? 3 to 4 minutes, 3 to 4 weeks, or 3 to 4 months? And while you guys are working on the answer, I'm going to come back and talk to Rory about some things. So Rory, one of the things that patients ask are fillers painful? Do they hurt to get done?
You know, some areas can be a little bit more sensitive than others, and so we do use a topical numbing cream. So we'll usually leave that on there for about 15 or 20 minutes or so. Some of the other options we do have is maybe if we are doing the lips, we'll both offer lidocaine injection, which we'll call the dental block, and that makes it a lot less painful.
I liked it. She tried to stay away from dental block, but because once you say that, we all get nervous. But we do. But it makes the lips a lot easier. All right, so we have a winner. Who's our winner? Anna B. We try not to use your last name. I may mess up. I apologize. But Anna B is the winner of the 30 units of Botox. Congratulations, Anna. That's awesome. So, hey, we got our first winner. Second prize is going to be for syringe of Juvederm, and either Rory or I will decide what we think is the best for you, depending on what you want to have treated. So, syringe of Juvederm. And the question is, how many treatments are needed for Kybella to fully work? Is it 1 treatment? Is it 2 to 4 treatments? Or is it 21 to 29 treatments? All right, so I think one of the cool things, and Rory said that, she talked about smooth threads. So we talked about kind of what it's for. Where most common areas for those smooth threads do you use?
I love treating those little fine lines above the lips. I feel like that's such a hard area, whether you're using some fillers and in combination with those Pdo Threads as well. And sometimes we lose the definition around the border of our lips, and so I really like enhancing what we call the vermilion border with some of those twisted threads.
Yeah, that's awesome. And when I started doing fillers 17 years ago, we didn't really do anything for those. So that's awesome. Threads are cool. So we have a second winner. Who's our second winner? Lisa C. Congratulations. So we got Anna B. and Lisa C. So congratulations. Rory, awesome job. I'll see you in a little bit. We're going to go ahead and change rooms. So hang in there with us. Thanks for being here. We'll be right back. All right, hey, welcome back. We're in our second treatment room. And just to tell you how live streams go, we're getting ready to get started. We're on this first stage, and this stranger's up at the front door trying to get in. And he's trying to get our needles and sharps, and he never comes in the afternoon. So that's some of the things we get to deal with today, but we'll just keep plugging along here. So we are in the treatment room that does Coolsculpting and Ulthera. Karina, why don't you tell me about Coolsculpting? What's unique about Coolsculpting?
Well, so Coolsculpting actually freezes the fat cells and causes them to be eliminated through the lymphatic system. The nice thing about doing Coolsculpting at SKINovative is that we have your own dedicated room to it. You're the only one that's in here. You can watch Netflix. We have Wi-Fi if you have to work. Some people like to get their work done. Others like to just come in and sit. No kids, it's quiet, it's cool, turn on Netflix and watch a movie that they want to catch up on, or simply take a nap.
I've done Coolsculpting here. I love it. It was so fun. I closed the door, watched my favorite movie. What are the most common areas treated with Coolsculpting?
So our gentlemen typically will do breast tissue and lower abdomen, some on the back. Our ladies, mostly lower abdomen is where they like an inner and outer thigh.
Awesome. And here's the question everybody's going to ask. They ask two questions about Coolsculpting. Does it work?
It absolutely works. I've done it myself. Dr. Fulton has done it, and we have lots and lots of very satisfied clients.
Yeah, awesome. And number two, is it painful?
It is not painful. Old technology, it was a little bit more uncomfortable because the applicator had more of a U design. These ones have more of a C design, so it's not sucking that tissue so far back into an applicator.
Awesome. So it works.
It works.
It does. It's not painful, and I love that. And we've been doing Coolsculpting for how long here?
We've been doing it since 2013.
So 8 years, and we've treated hundreds of patients. It's really good. It's awesome.
A lot of people call it lunchtime lipo, where they get to come in, relax, it's completely non-invasive, and then within about 2 to 3 months, they'll start to see some results, and they'll be at their maximum results at about 6 months.
Okay, awesome. Second thing we do in this room is we do Ulthera. What the heck is Ulthera?
Ulthera is a ultrasound guided technology where we go in and we tighten through heat the SMAS layer, which is a layer of the tissue deep in the skin.
Love it. How often do you get to use the word SMAS in a sentence? That's very cool.
Not very often.
Not very often. So again, the question is, does it work?
It does. Again, it takes 3 to 6 months to start to notice any effect with the Ulthera. But the nice thing about it is it's a lifting tightening. It is not a pull like a facelift. It's more of a lifting and tightening, which makes it nice because we don't want to look drawn. We want to look youthful. And youthful is where all of our skin is tighter and lifted up.
So one of the big things about Ulthera, it is FDA approved for lifting. It's not just tightening, it's lifting. So it's outstanding.
It is.
So awesome. Let's do a prize. All right, everybody get your...
Ta-da!
So we are going to do... Dr. Fulton's got to look at his questions. All right, everybody get your name down and get ready with your answer. So this is for one Coolsculpting cycle. And the question is, does Coolsculpting work? Yes or no? Hopefully you get that one right. So I wanted to come back with Karina while we're waiting for that answer. So what are the common areas that are treated with Ulthera?
Ulthera we can treat from the hairline all the way to the bottom of the décolleté. The most common area is submental. Ladies don't like to have what we call or consider our turkey neck, so it really helps create that tightening. It is the foundation of the face, so once we get that tight, we have the muscles that here can sit on it, and it helps hold the neck muscles so that we get that tightening through here.
Nice. Are there a lot of bruises that happen with Ulthera?
You know, again, it's completely non-invasive, so bruising is very, very minimal. Sometimes if we go real deep, somebody that has thinner skin, less collagen, they may see a little bit of bruising at about 2 weeks after, and they'll just get a light green hue along their jawline.
Nicest. Let's check and see if we have a winner yet. All right. So our winner for a Coolsculpting cycle is Gabriella H. Congratulations. That's awesome. All right. Our second prize in this room is going to be for 30 units of Botox. So again, this is for 30 units of Botox. And the question, get your name down. Get your name down because I want you guys to win. Question is, how long does it take to start seeing the benefits of Ulthera? Is it 2 to 3 minutes, 2 to 3 weeks, or 2 to 3 months? And we'll let you do that. And then, Karina, coming back, we talked about Coolsculpting. We talked about the common areas. One of the things we didn't talk about was how long does each cycle take?
Well, cycles vary. There's 3 to 4 different panels or paddles that we use or applicators. We have a flat panel that does more inner thigh, outer thigh, bra fat area, and that one takes 1 hour and 15 minutes. We also have bigger cycles that we do lower abdomen. Those take 45 minutes, and then we have one that's smaller than that to do more curved areas, smaller areas, and that one's also 35 minutes.
So that's awesome. In the old days, it all took 1 hour. And so what they've really done with, especially those smaller cycles, those have got squished down, you said 30 minutes?
35.
35 minutes. So that's awesome. And who's our winner on the 30 units of Botox? So Brenda A. Brenda A. Congratulations. So hey, you guys are doing awesome. Thanks for listening. We think, Karina, awesome job. We're going to be changing rooms. So hang in there with us, have lots of great prizes remaining, and we're going to be talking about some really interesting things as we keep going. So we look forward to seeing you in just a couple more minutes. right, everybody. Third treatment room, and the treatment we're talking about today is weight loss. You know, in our country, 2/3 of the population are either overweight or obese, and it is a challenge. And we all know about confidence and not fitting good in our clothes and what can we do, and there's all kinds of options out there. We have 2 programs, and those programs can actually be combined. So I guess you could say we have 3 programs. The first program that we use is Phentermine. Phentermine was FDA approved for weight loss in 1959. If you think about it, that was a long time ago. And so there's definitely a nice safety profile for Phentermine. Phentermine is an appetite suppressant. And so it works by having you not feel hungry. And so when you're not hungry, hopefully you don't eat as much as you normally do. The challenge with that is a lot of us eat when we're not hungry anyways. We eat because we're tired, bored, anxious, come home late from work and want to relax. But again, it'll help decrease that appetite. It is a stimulant. And so if you think about any process where a stimulant can cause problems, we have to worry about that with Phentermine. So if somebody has high blood pressure, it can make your high blood pressure worse, but usually if somebody has high blood pressure and they're currently on medications, they do very well with Phentermine. The other patients, or if somebody has an anxious personality, probably wouldn't want to use Phentermine because that could make their anxiety worse. And then number 3 is it can make people have trouble sleeping at night. If you said, Dr. Fulton, what's the number 1 risk of Phentermine? It's going to be insomnia. But again, most people, if they take it in the morning, they do very well with it. And so I love using a medication on the right patient at the right time, especially since it's been around since 1959. That's awesome. The second weight loss program we have is HCG. On our website, you'll see it called Hormone Assisted Weight Loss. HCG is where we like to use injections. You do injections with HCG. HCG was first used for weight loss in the 1950s. So again, we're using 2 programs for weight loss that have been around since the 50s. Pretty amazing. And HCG, what I love about HCG is the results. The results of HCG are amazing. It's a low-calorie weight loss program. It really reprograms the way somebody eats. All the foods that are on the HCG weight loss program have nutritional value. Nutritional value, as you know, are vitamins, minerals, fiber, protein. When you're eating, if you just think about, does this have nutritional value in it? If all of us just ate that, it'd be a lot harder to gain weight. And so again, HCG, low calorie, and after you get started on that program, after the first 2 to 3 days, most of the time patients aren't hungry. So it's awesome. For those patients that get a little bit hungry on it, we can obviously add Phentermine if we need to. So again, our weight loss programs are Phentermine or HCG or the combination of HCG and Phentermine. All right, first question. All right, get your name typed in. All right, the first question is, and I gave a lot of numbers on this. I hope you remember this one. This is for a weight loss program. Your choice, obviously, if you're not a candidate for Phentermine, we wouldn't do that one, but Phentermine or HCG. And the question is, what was the year Phentermine was approved? Was it 1859, 1959, or 2019? While you're coming up with your answer, I'm going to keep talking a little bit. You know, HCG, we've been doing HCG really since we opened, and Phentermine since we opened. That was back in 2009. And both of those programs are very effective. We love to see patients lose weight. Again, we love the confidence. Looks like we have a, thought we had a winner. I had a hand up there. We love to see people. We love to see the results of that. And again, when you're carrying less weight, you're feeling better. It's awesome. So we have. All right. So Shelby R. Congratulations, Shelby R. That's awesome. It's kind of fun hearing these names because I'm seeing your faces. So that's awesome. I love that. All right. Second prize is a B12 package. It's amazing how many people love B12 for energy. We have a group of clients, that's all they come in for, is B12 injections. They love the way B12 makes them feel. So this is for a B12 package. That's a package of 10 injections. And the question is, HCG was first used for weight loss in 1895, 1925, or the 1950s? All right, see if you remember that. And again, that's for a B12 package. So again, B12 injections, some of our patients like to come in every 2 weeks for that. Some of our patients like to come in every week for that. Some patients like to come in every month. And again, it's a injection that a lot of people like to use for energy. We also combine that with our HCG weight loss program. Our HCG weight loss program really is a program where we have you come in on a weekly basis, we weigh you, we give you an injection of the B12, and we ask you how you're doing. And it's really interesting, like most of you, you know, if I'm actually going to have somebody checking up on me, I'm going to really be doing my best. And so we've had some great success with HCG. Let's see if we have a winner here. All right. Candida G. If we're saying your name wrong, I apologize. I apologize. Again, I love doing weight loss. I love the benefits of weight loss. I love just being proactive about health. And as always, if you have any questions about any of the programs or the products or services that we offer, please give us a call. As you know, we always have a complimentary consult. We're going to be changing to our 4th treatment room. And we're going to, again, put some slides up there, and looking forward to see you in about 2 minutes, 2 to 3 minutes. All right, everybody, we're in our 4th treatment room, and for a lot of our clients, this is the favorite room, which hurts Rory's and my feelings, but that's okay. It's probably my favorite room, too. And this is where Sarah does all of her magic. Sarah, why don't you tell us a little bit about you?
Yeah, so I am a licensed esthetician and a certified medical laser technician. I've worked in medical aesthetics now for 16 years, and I've been part of the SKINovative team for 6 years.
So some of the things I wanted you to hear is she's been doing this for 16 years. So she didn't just finish up with school. She's treated thousands of patients. And what's great about that is skin is really a unique area for each of us. And so one treatment might work for somebody and might not work for somebody else, but you want to be going to a skincare specialist like Sarah, who really knows the field of skin and can offer lots of different treatment options to help you with your goals. So the first treatment we're going to offer, which might be my favorite, is a Hydrafacial.
Yes.
So Sarah, tell us about a Hydrafacial.
Yeah, and you know, our beautiful model Denise here, we actually just wrapped up a Hydrafacial on her. So it's actually one of my favorite skincare treatments. It's a very therapeutic treatment, but it yields no downtime. So, you know, post-treatment expectations is just a nice fresh glow. And it's a 4-step process. So first step, we're going to be exfoliating and doing a deep cleanse. Then we are going to be doing a mild chemical resurfacing or a chemical peel. We do extractions, and then we do a deep dermal infusion, which focuses on anti-aging and helping to even out the skin tone.
That's awesome. And one of the things is when she does those extractions on Dr. Fulton, you should see the fluid. It is amazing what she gets out of this nose. So I'm thankful for that. Yeah, and this is one of my favorite treatments. I mean, literally, I fall asleep when I'm doing it, and when I get out of here, I have a glow. So it's one of my favorite treatments for sure.
Very relaxing.
Tell me about microdermabrasions. You know, we have a lot of patients that do that. What's a microdermabrasion?
Yeah, so microdermabrasion is a mild exfoliating treatment. We utilize a machine that has a handpiece with a small stiff brush on it, and that helps to remove dead skin cells and refine the texture of the skin. And from that point on, then we're really kind of customizing the treatment to our patient's needs. So depending on the skin conditions, we're going to choose an appropriate treatment mask. And so the mask will be applied. It remains on the skin. Once it's removed, then we'll do any necessary extractions, and then we choose condition-specific medical-grade topicals to kind of round out our treatment.
Love that. And so again, you heard customizable, super important. You know, it's your skin type is different than mine, then is this different than Sarah's, different than Denise's. Thank you, Denise, for being here. That's awesome. How about chemical peels? Do all chemical peels make me look like a snake when I walk out of here?
Well, you know, Denise is actually a perfect example of that. So part of the Hydrafacial is a mild chemical resurfacing or a chemical peel. So you can see that her skin just looks beautiful and glossy and glowing. So that is on the more mild end of the spectrum. We do have some medium depth peels where the skin might get a little bit dry and flaky a couple days after the treatment. And then we have a little bit bigger guns that we can pull out, more of a medical grade application, which will yield visible peeling and flaking. So a little bit deeper resurfacing, a little bit more therapeutic in terms of discoloration of the skin. So one of the things that I as a provider want to be very mindful of when I'm partnering with patients is you know, everyone's comfort level. Some people don't mind to have visible peeling and flaking, and for others, that's a big deal. So we want to customize our treatment plan and choose our chemical peels carefully so that we are allowing our patients to go about their lifestyle with confidence.
I love that. Yeah, I love that. Awesome. And then the last one is microneedling. I hear a lot about microneedling.
Yes.
Tell me about that.
Yes, microneedling is a fantastic treatment. So it is a modality that I love to go to for any type of textural issue. Fine lines, wrinkles, crepey skin, acne scarring, even surgical scarring. So it can be performed on the face, the neck, the chest, anywhere on the body. It is a treatment that is also called collagen induction therapy. So by creating that kind of controlled wound in the dermis, and as your body goes through the wound healing response, it's going to promote that collagen synthesis, an amazing resurfacing.
Now, this is probably a silly question, but it says needle in that. Are there needles in
There
microneedling?
are needles,
There's
yes.
needles in that.
There are microfine needles that are creating little channels in the skin. So again, that's that controlled injury, which puts the body into that wound healing response and helps to give that ultimate rejuvenation.
Love that. Now, we use Skin Pen. Tell me what's unique about Skin Pen.
Skin Pen is a fantastic modality. It is one of two FDA cleared devices on the market for microneedling. So it is one that has been devised so that it causes less inflammation in the skin, so you're not going to have as much downtime, but you're still getting all the fantastic benefits of that collagen induction.
Love it. So, you know, one of the things that we're trying to do, again, is offer best products, best service, and so having a Skin Pen, which is FDA cleared,
Yes.
obviously that's good for you to know. All right, time for questions. Get your name put in. All right, here we go. Let's see if Dr. Fulton has the right question. All right, here we go. Sarah gave the answer to this one. Actually, she gave the answer to both of them. So the first one is, how many steps are there in the Hydrafacial treatment process? How many steps are in the Hydrafacial treatment process? Is it 1? Is it 4? Is it 32? I'm trying to help you out there. All right, so a couple more questions for Sarah, because when you have somebody with 16 years of skin experience, you got to take advantage of that. So, Sarah, we do something called a Hydrafacial or a vampire facial.
Yes.
What is that?
So that is the Mac Daddy of all the treatments.
I was hoping you'd say Mac Daddy.
Yes.
Okay.
So what we're doing with the vampire facial is we are utilizing our patient's own platelet-rich plasma combined with the microneedling treatment for maximum rejuvenating benefits. So you're going to notice a greater wound healing response, a firmer texture to the skin, and a shorter healing time as well. So again, this is your body's own growth factors that are being introduced into those little microchannels. and the result is just absolutely phenomenal. So it's something you can do as often as monthly, or it might be something that you might want to sprinkle into your treatment plan. Maybe quarterly, and then you're doing some more mild treatments like microdermabrasion, hydrafacial, in between those treatments. So for best results and for optimal skin health, you're going to want to be treating on a monthly basis. And so whether that's mild treatments done on the regular or sprinkling in some of the more therapeutic modalities for a more dramatic response, there's really no wrong way to do it. It's just about customizing it for the patient's needs.
I love that, and I like the consistency. Being consistent in anything, you're going to get better results. And we recently had a patient who had done all the services here, but she hadn't done any skincare. And she started recently doing skincare, drastic change. So
Yes.
I'm a big believer in being consistent with your skincare, doing good daily skincare treatments, and then monthly
Absolutely.
treatments where you're coming here, big difference. Do we have a winner on that? Slowly. All right. So we'll keep
getting there.
going.
Well, and Dr. Fulton, something else I'd like to touch on
Yeah.
is while we performed Hydrafacial on Denise, we also incorporated an additional modality into the treatment.
Oh, what's that?
So we actually prepped her skin by doing a Dermaplane, which is another mild exfoliating treatment, but the added benefit is it removes fine vellus hair from the face.
Okay.
So patients love this treatment. It creates just a really smooth texture to the skin. It's great for those who are doing regular makeup applications or maybe have a special occasion on the calendar. And again, for those who desire a more dramatic result, you can actually combine those two treatments. So we started by dermaplaning Denise, and then we went right into our Hydrafacial treatment.
Love it.
Yeah.
All right, we're gonna redo that question. Maybe Dr. Fulton wasn't very thorough.
We stumped you.
Oh. Okay, I understand we're having some technical difficulties. Shocking on a live stream, but we'll keep working this. So I'm going to ask you 2 questions, so you can answer whichever one you want. So the first one is the one that I've already asked, and yeah, I didn't tell you what you win. That's probably why nobody wanted it. They're like, I don't want to win that. So the first one is for a syringe of Juvederm. That's pretty cool. So for 1 syringe of Juvederm, the question is, Sarah said, how many steps are in a Hydrafacial? And my answers were 1, 4, or 32. 1, 4, or 32. How many steps in a Hydrafacial? Again, get your name in, try that. And here's the second question. We're just going to go for it because that's why we are at SKINovative. This is for a Hydrafacial. And so the question is, this is a hard one. Which treatment does Sarah do that uses needles? I'm not even going to tell you. You know which one that is. Which service does Sarah do which she uses needles? So while we're waiting for those, Sarah, there are different types of Hydrafacials. Why don't you tell us about the different ones? Because I don't know which ones are different and what they do. So why don't you tell us about that?
Yeah, that's a great question. We actually offer 3 different Hydrafacials. So our signature Hydrafacial is comprised of the 4 steps that I mentioned.
You just gave the answer away.
And so we are always going to start off by exfoliating and cleansing, doing that mild chemical resurfacing, extractions, and then our dermal infusion. So that is a signature Hydrafacial. We also offer a clarifying Hydrafacial, which can be a little bit more customizable to patient skincare needs. So what we would do is, in addition to those first 4 steps, we would build in a booster. So we have boosters that are targeting acne or redness, rosacea, anti-aging, even discoloration of the skin. So it's kind of an additional step to just kind of beef up our results with the Hydrafacial.
Nice.
And then our Performance Hydrafacial has all the wonderful things that I've mentioned previously, but then we're also going to do a lymphatic massage, and we're going to utilize some red and blue light therapy on the skin. So the red lights are great because they help to reduce inflammation in the skin, reduce redness. And then the blue lights are great for antibacterial or anti-acne control. So in some skins, I'm using just the red lights, and in some skins, it's just the blue. And some skins, I'm going to do a combination of both.
That's awesome.
Yeah.
Great answer. We have... Okay. Okay, so winner number 1 is... Debbie M. Congratulations,
Yay,
Debbie M.
Debbie! Woo woo!
For Juvederm. And do we have winner 2? We're still working for winner 2. So again, that was for a Hydrafacial. That's for a Hydrafacial. And I think that one was, which treatment does Sarah do that uses needles? That was the one. All right, cool. Let's see. Let's just go back through here. Let's see what else we can do while we're waiting. Actually, what we'll do while we're waiting, we're going to go ahead and, because your time is worth a lot, just like ours are, we're going to go ahead and move on, and we'll be looking for that second winner for the Hydrafacial, and then we'll go to our 5th and final treatment room.
This, to me, was huge. My neck and chest are amazing. These are silicone patches that you put on your skin and wear them for like a couple hours, and then it minimizes the impact of the wrinkles.
Within the skin under this, it is creating this warm, moist environment to get my skin to do what it naturally would do in order to rejuvenate and plump up and improve overnight. So I love this.
Hey, sorry about the technical difficulties. You know, when you're going live, that just happens. But thanks for hanging in there with us. I've got Rory back, going to help me talk about, oh, I'm getting the winner. So Glenda R., you won the Hydrafacial. Is that right? Glenda R. I've got so many smart people helping me today. It's awesome. And again, that's what we need here at SKINovative. We have a great team. So love it. So Sarah talked a little bit about PRP, platelet-rich plasma, and she said a little bit, platelet-rich plasma has lots of growth factors. And so if you have growth factors, you can use it for lots of different things. And it's been used for many years in medicine. We've actually brought the benefits of PRP into our practice. And so the first one that I'm going to talk about is PRP hair restoration. And the first question I get is when you look at me, you say, well, Dr. Fulton, if it works so great, what happened to you? And I say, well, there's certain questions that Rory and I both ask. And one of those questions is, how long have you been losing your hair? If you've been losing your hair longer than 10 years, probably not going to be the right treatment option for you. And so I have men that come in that look like me, and we talk about the draft. In fact, the NFL draft is on tonight for all you wives that are interested in that, or men. But not a good candidate. But if you haven't been losing your hair for a long time and you still have a good amount of hair and you aren't on any bad medicines, then PRP hair treatment is awesome. And we've treated hundreds of patients. It works great. There is one medicine that might be important for you to remember in the future. There is a medicine that some people take that makes using PRP for hair treatment a little bit harder, and that's testosterone. And the reason for that is testosterone often gets converted into that DHT, which we hear a lot about. And so if you're on testosterone, it's going to decrease the effectiveness of PRP. So don't forget that. All right, Rory, tell me about the PRP O-Shot.
So in addition to doing facial rejuvenation and hair restoration, we have female rejuvenation. And so this is where we can do a couple injections. Again, we're using your PRP, and treatments like increasing sensation, stress urinary incontinence. So if you're jump roping, maybe a sneeze here and there, that can help with that as well. Again, we're just kind of rejuvenating some of those cells, increasing blood flow. It's a lot of good beneficial things you can use.
Yeah, that's awesome. So one of the things I think about, if we're doing that treatment, that's got to hurt, right? Does that hurt, Rory?
You'd be surprised. It's actually pretty comfortable. And we do topical numbing, but that's really all anybody needs.
So topical numbing, about 10 or 15 minutes, and then the treatment. Yeah. Is that a kind of a one-and-done treatment, or what do you recommend for the O-Shot?
So it's different for a lot of people. Some people respond very, very fast and very well. And some people may need a couple treatments. So spaced about 4 to 6 weeks apart, you can come in and get another treatment. And then you might be good for a year or 2 years. So you can maintain that as much as you want.
Love it. Awesome. So again, just one more quick thing about PRP. PRP is really all about the number of platelets that you use. So when we're doing PRP hair treatment, the more platelets that we have, the better it's going to be. And so we use a system that allows us to use up to 15 or 16 milliliters of platelet-rich plasma. There's no other system that allows us to do that. And so again, just again for our clients and the individuals on this live stream, we're using the best technology to help our patients get the best results. Next is hormone replacement therapy. You know, I started working for a wellness clinic in 2000, so 21 years ago. And one of the things that I started doing was hormone replacement. And hormone replacement in the right patient is magic. Hormone replacement means retreating ladies with estrogen, testosterone, possible progesterone, for men, testosterone. We use pellet insertion, and the nice thing for our patients for that is once that pellet's inserted, if you're a female, you only have to get treated every 3 or 4 months. For men, maybe every 6 or 7 months. So lots of benefits to that. The other thing is, not to get in the weeds with explanation medically, but because it's put into your fat, into your hip, it doesn't have to be metabolized by your liver, which is just a much safer way to do that. So we love using hormone replacement therapy. That's one of those treatments where I'll sit down with you. We'll talk about your goals. We'll talk about lab tests. So your labs obviously have to match somebody who needs that. But for the right patient, and that's a lot of patients that we see, really makes a big benefit. Rory's going to talk about Pdo thread lifts.
Yes, one of my favorites. We do use these in combination with fillers sometimes. And instead of using fillers for that volume loss, we will use those Pdo threads to lift and tighten the skin. So sometimes where we see some of those nasolabial folds, some of that jowling that everybody hates, and yes, everybody gets it, and some of this laxity on the skin as well. So we'll use some of those longer shaped threads, which we call barbs, because they're actually shaped like a barbed wire fence, and that's what's holding up that tissue. They are resorbable, so they do dissolve, and you'll get that lasting effect because it is stimulating that collagen.
Yeah, awesome treatment, immediate benefits, and then over time your collagen takes over, so awesome treatment, awesome. The other treatment is a Y-lift. A Y-lift is, as Rory was saying, the thread lifts help with lifting, obviously. Sometimes it's more of a volume problem. And so if we have a patient who has a volume problem, the Y-lift might be the way to do that. And the filler that we use on that is a Voluma. And again, just showing that we have all kinds of modalities to help our clients get the best results. And so Y-lift, we do quite a few of those. And again, very effective on helping patients look well. Scleral therapy. That's a big word. What does scleral therapy mean?
Scleral therapy is an injection that we use to treat some of those little red spider veins. Those are called telangiectasias, and it's more for cosmetic purposes, which we live in Arizona, so we're all wearing shorts all year round, and so legs is the most common area we treat. And we use the polydolcinol solution, which is an irritant, and so we can close up those veins and make your legs pretty again.
That's awesome. So is it like a one and done with scleral therapy, or how many treatments do you tell your patients it might take?
It'll typically take about 4 to 6 treatments, about a month and a half apart.
Perfect. Love that. And then one of the things we're really happy to offer our clients, if you can't get that, we really love our clients, and we don't like hurting them. And so Rory talked about doing topical anesthetics. She used that D word, that dental block that we can use to help patients feel a little bit better. And then we also have something called nitrous oxide or laughing gas. And it really does make patients laugh, doesn't it? It's kind of cool. The great thing about nitrous oxide, we've used it hundreds of times here. It's great for certain procedures that take a little bit of time. The patient is in control of that delivery system, and it starts working in 30 to 60 seconds. You might want to remember that for a question coming up. And then when you're through breathing it, it's completely out of your system in about 5 minutes. It really has changed the way we do procedures here. Again, it's not for every procedure that we do, but for the procedures that we use it on, not to overuse the term, but it's a game changer. Really makes a big difference. So let's ask some questions, and then we'll come back and I'll ask Rory some questions. So, we're going to start with that nitrous oxide laughing gas question. So how quickly does laughing gas take to work? Oh, You're winning a syringe of Juvederm. Syringe of Juvederm. Thank you. How quickly does laughing gas take to work? If you already know, put it in there. Is it 3 to 6 seconds? Is it 36? No, that's bad. 30 to 60 seconds, or does it never work? I don't even know what those questions were. I would go with 30 to 60 seconds. Holy cow, it's
That was
working.
fast.
Jamie F. Awesome. Congratulations. That's awesome. I didn't even get a chance to ask Rory more questions. Dang it. All right, scleral therapy. Again, Rory talked about scleral therapy. Again, that's treating those spider veins. And Rory gave a number of treatments that it may take to get those veins like you want them. Is it, oh, goodness, yeah, I forgot what you're winning on this. No, I'm saving that one for later. So this is for a 30-minute session of scleral. I'm saving a lot of gifts for the last, so don't leave me. So this is for a 30-minute scleral therapy session, and the question is, how many treatments may it take using scleral therapy to get those veins like you want them? Is it 1? Is it 4 to 6? Is it 40 to 60? Carrie B. Carrie P. Wow, you guys are awesome. Rory, you're off the hook.
I know.
That's what happens when you get a
My
good...
job's easy now.
That's awesome. All right, so Rory, that's awesome. We're actually going to show some slides, and I'm going to describe the elite programs for you. And so we're going to wait here a second and let Justin put those up. All right. So I'm going to explain these programs to you, and then we're going to give away some prizes, and then we'll get you out of here. Thanks for being here. We're right at an hour, so I appreciate you staying. So
There's no delay on that. No,
the SKINovative Elite, the SKINovative Elite Luxe program. So again, SKINovative Elite Luxe is $199 a month. And with that, when you sign up, you get $300 worth of perks right off the bat. You get complimentary 10 units of Botox. You get a complimentary skin analysis and treatment plan. And you get $100 off Coolsculpting gift certificate. The monthly treatment options you have, and again, we give you a bunch of them. Signature Hydrafacial, DermaSweep, Microdermabrasion, Dermaplaning, or a 60-minute customized facial. Anytime savings. So if you're somebody who uses Botox, you're going to love this one because you're going to take $1 off of each unit, so you can multiply that savings. If you're somebody who uses fillers, you're going to get $50 off of each syringe. And then you're going to get 10% off all skincare products and 10% off all skin rejuvenation services except for the Ulthera. And then some additional benefits, $25 birthday bonus, $25 referral rewards, and then we're going to be given some exclusive member-only promotions. So that's that one. The second one that we have is the Elite Deluxe. So the Elite Deluxe is $399 a month. Just for signing up, we're going to give you $550 in perks for joining, and that's going to be a complimentary FDA-cleared skin pin microneedling treatment. We're going to give you a complimentary skin analysis and treatment plan, and we're going to give you a $200 gift certificate of your treatment of choice for either a Pdo full face threads, PRP microneedling, PRP hair restoration, or the vaginal rejuvenation O-shot. And then the quarterly treatments, you're going to have your choice. You can either do 50 units of Botox, you can have a bioidentical hormone replacement treatment, or you can do a skin pin microneedling with PRP. So that was that vampire facial we talked about. Monthly treatments, your choice will be that performance Hydrafacial, Microdermabrasion and Dermaplaning, Dermaplaning and Peel, 60-minute European facial, or a medical grade peel. And then anytime savings, the Botox will take $2 off each unit. Although if you're getting 50 units a quarter, you're probably not going to need that. 15% off all skincare products, or 50% off all skin rejuvenation services, or $75 off of Juvederm syringes. And then 10% off Coolsculpting and 10% off medical weight loss. And then some additional benefits as before, $25 birthday bonus, $25 referral rewards. So if you just look at the savings right off the bat with the Elite program, you're going to save almost $900. That's really a minimum. And the Deluxe program, you're going to save about $2,500 a year. So we're excited about those programs. We're excited about you getting the best results that you want. We love having you come in more consistently, and obviously getting the results you want, and having you look and feel better. So let's give away some more prizes. All right, so the first one is going to be for 30 more units of Botox. 30 more units of Botox. And I don't know if I talked about this one. I did talk about this one. Can you use HCG and Phentermine together? Can you use HCG and Phentermine together? Again, that's for Botox, 30 units. Oh, Naylene B. You won that, Naylene B. Yes, tell your husband, Naylene B, I said hi. All right, now for a syringe of Juvederm. Now for a syringe of Juvederm, and I'm trying to make sure that we talked about this. For a syringe of Juvederm, how many types of Hydrafacial are there? Is there 2 types or 3 types? 2 types or 3 types? Sarah talked about that. Are there 2 types of Hydrafacials or are there 3 types? So we'll see what we get for that. Obviously, there's a lot of stuff we've talked about. We've had a little bit of technical difficulties. We really appreciate you hanging in there with us today. If you have any questions about this, please give us a call. Come down. We'll just visit with you on this. Rachel B. So you won that syringe of Juvederm, so thanks for hanging in there with us. The next one, this one's going to be for a European facial. We didn't really talk about European facial, but that's where you get a facial and you get a foot and hand massage. I'm snoring when I get that done. It is awesome. When I wake up, my face looks great and I'm completely relaxed. So I highly recommend a European facial. The question for this one is, does testosterone decrease the effectiveness of PRP for your hair? Does testosterone decrease the effectiveness? And so that's going to be a yes or a no. And I did talk about that one, spent some time on that. So either will testosterone affect your PRP treatment for hair? Either yes or no. And we didn't really talk about the number of treatments for PRP for your hair. It's usually 4 treatments, and we do them a month apart. And we can treat anywhere, top, back, front. It's really an aesthetic procedure wherever people want. And if somebody has complete hair loss or they're thinning, we can treat the entire top. Yes. Okay, I didn't do a good job explaining that one. So testosterone is not good. So it's yes, the answer is it's not good. So let's give you another one. That's Dr. Fulton not doing it because I want somebody to win the European facial. So let's do this. When did we open SKINovative? Did we open SKINovative in 1999, 2009, or 2019? That's a long time ago. Sorry about that. 1999, 2009, or 2019. Let us know when you think we opened SKINovative. And again, we appreciate you hanging over. We're a little bit over an hour, but we want to give you these prizes. Amy G, who drives a long way to see us. We appreciate you driving so far, Amy G. Thank you. And the last one is for an O-shot. Again, we have to be careful on this video of all the benefits of that. I think Rory did an awesome job. So this one's going to be for a O-shot. And does an O-shot help with urinary incontinence? Again, urinary incontinence is when you jump or cough or sneeze and you lose a little bit of urine, urinary incontinence. Does an O-shot help with urinary incontinence? Again, thank you for being here today. We really appreciate it. Again, we've gone over a lot of stuff. If you have any questions on anything, please call us. Again, everybody who's been on this, you're going to win a prize just with a bag, and then we've got one more prize. Paula N. Awesome job. All right. That is the last of our giveaways. Again, we appreciate you sticking on. We appreciate you hanging in there with our technical difficulties and the man banging on the front door and all those things. We really appreciate you most of all. We just appreciate your trust in us. We appreciate that we've been able to become part of your family, and we appreciate you being part of the SKINovative family. Again, look forward to seeing you soon. If you have any questions, please give us a call at 480-917-7546 or visiting us on our website at gilbertmedspa.com. So I'm being told to get your bag, you can come by next week. So starting on Monday, come by for that. But you can sign up for the membership program starting tomorrow. Tonight, we're not going to have the ability to do that. So again, thanks for everything. Thanks for hanging in there with us, and I hope you have a great night.